Good morning. I think it's still morning. Thank you for the members of the media who've come to attend this briefing, and also to Islanders who may be listening on this very rainy and blustery morning. The original intent of this briefing was to discuss the positive news regarding the rollout of the pediatric COVID vaccine to children ages 5 to 11. In light of the events in the last week, I will use the time to provide an update on the COVID-19 situation. In the Atlantic region, there are 887 active cases, including 688 new cases in the last 7 days. Our neighbors in New Brunswick reported 219 cases over the last 3 days, including 90 on Sunday, while Nova Scotia had 60 new cases over the weekend. I would note that in New Brunswick, there are 17 schools impacted by COVID-19, as well as 6 childcare centers. There is an outbreak at the Moncton Hospital, and they have 33 in hospital with 15 in ICU. Today, there are 7 new cases of COVID-19 to report in P.E.I. 6 of these cases are related to cases that were announced previously. They originally tested negative, and 1 case is still under investigation. The age ranges of the cases vary, and none of these cases are under the age of 19. We currently have 28 active cases and a total of 356 cases since the pandemic began. Last week, we had 17 new cases of COVID-19, our second highest weekly count since the pandemic began. And so far this week, we've had 12 cases. There is a cluster of cases that began on November 17th in Prince County. This cluster now includes 22 cases which are linked to this cluster. 2 workplace outbreaks, 2 sports teams are involved, and 1 case at Three Oaks Senior High School. Approximately 350 close contacts are being followed. Over 200 individuals are following the daily testing for school contacts protocol, and 2,454 lab-based PCR tests have been completed since last Wednesday. As mentioned publicly, the workplace outbreaks are not considered public exposures, as these businesses do not provide services to the public. There is the 1 case at Three Oaks Senior High, a close contact of a case related to the cluster in Prince County. The school was closed yesterday to allow for contact tracing, testing, and cleaning of the school. At this point, there is not an outbreak at Tosh, as there is no evidence of COVID-19 transmission within the school setting. Students and staff of Three Oaks who are close contacts of the positive case, lunch mates, classmates, and are fully vaccinated, following a negative PCR test, will have the option to participate in the daily testing for school contacts protocol. They will be required to do daily home-based rapid antigen screening tests each morning, and they will require a PCR test on Thursday, November 25th and Sunday, November 28th. The school-based close contacts who are not fully vaccinated are required to isolate for 14 days from the date of last exposure. But I would like to mention a change, some initial direction for the bus students. Beginning tomorrow, November 24th, all students who traveled on buses 762, 568, and 584 who've had at least 1 negative PCR test, regardless of their vaccine status, can also follow the daily testing for school contacts protocol. This means that unvaccinated, partially vaccinated, and fully vaccinated bus students can attend school and extracurricular activities, provided they have a negative rapid antigen test each morning. Based on the initial negative test results and a further assessment of exposure risk, Public Health determined the testing protocol, including the additional PCR tests, is a reasonable approach at this time for students on the buses. We believe the risk of transmission is low. We would not be recommending the daily testing protocol and allowing students to return to school if the risk was not low. Parents and guardians of students who traveled on these buses will be contacted today regarding the daily testing protocol, and test kits can be picked up at Three Oaks today. This situation continues to evolve, and I expect there will be more positive cases in the coming days among close contacts who are currently isolating. It is concerning that transmission appears to happen very quickly and with minimal contact. We are reminded of situations in other jurisdictions where the virus was described as spreading like wildfire. The good news is we know that vaccination continues to be an important layer of protection that reduces the risk of individuals becoming very sick and having poor outcomes, such as hospitalization. Regular updates will be provided in the coming days. I'd like to highlight a number of important issues in relation to the cluster of cases that began in West Prince. First, people should not go to work if they are not feeling well. We have been giving this advice since the beginning of the pandemic. If you are not feeling well, the best thing you can do for yourself and others is to stay home unless you need to seek healthcare services. To the extent possible, employers should do what they can to support employees who are sick and unable to come to work. The advice to stay home when not feeling well applies equally to individuals who are fully vaccinated and those who are not fully vaccinated. The vaccine does provide an important layer of protection against COVID-19, but it is not 100%. Secondly, people with symptoms of COVID-19, even mild ones, should be tested at a health P.E.I. clinic, regardless of their vaccine status. Early detection of cases is key in limiting the spread of COVID-19. And thirdly, when returning from out-of-province travel, if you are not tested at the point of entry, be sure to visit a testing clinic or complete a rapid antigen screening test. And in addition, be tested again at a testing clinic between days 4 and 8. When children under 12 return home from out-of-province travel, they should be tested on entry, either at the bridge or by using an at-home screening test. Children must have a negative test prior to returning to school. Children under 12 must also test 2 more times on day 4 and again on day 8. Unvaccinated children under 12 years of age who return from international travel should isolate and not attend school, camps, or activities for 14 days. As of Saturday, November 20th, 94.3% of eligible island residents have received at least 1 dose, and 90.5% are fully vaccinated with 2 doses. And reaching 90% fully vaccinated is a significant milestone. Thank you to the 131,600 islanders who have done their part in the fight against COVID-19 and are fully vaccinated. The rate of full vaccination in the under 30 age group is still below the provincial average. 80%, for instance, in the 20 to 29-year-old cohort. We are still aiming to continue to vaccinate people as quickly as possible and as many people as possible. And also, I may mention this again, it's also important that those who are eligible for boosters, 70 years of age and up, for instance, where it's been 6 months since their first series, that they should book an appointment for their booster dose. We've had questions regarding the vaccination status of our cases, and since January, 24% of our cases have been fully vaccinated, and 76% of our cases were not fully vaccinated. I know there may be some more specific, more recent questions regarding the vaccine status of our cases, including this fall. And given the situation that's ongoing at the moment, the current priority of our current cases and contacts, but we will have that information available as soon as possible. We were pleased to learn that Health Canada last week approved the Pfizer BioNTech COVID-19 vaccine as the first pediatric vaccine for use in children in Canada. The National Advisory Committee on Immunization, or NACI, recommends children aged 5 to 11 years of age who do not have contraindications be offered a complete series of the Pfizer vaccine with a dosing interval of at least 8 weeks between the first and second doses. The vaccine has been specifically formulated for children ages 5 to 11 years of age, and they will receive 1/3 of the adult dose. The clinical trial data suggests the pediatric formulation produces a good immune response in children, similar to the response seen in adults. Preliminary efficacy of the pediatric vaccine against symptomatic COVID-19 in children is estimated to be 90.7%. The pediatric vaccine clinical trials did not reveal any serious side effects. Interim clinical findings did not indicate any safety concerns, and no cases of myocarditis and/or pericarditis were related to the vaccine. In addition, over 3 million children in the United States have received the pediatric Pfizer vaccine, and there has not been any safety concerns. We expect to begin receiving the vaccine today, if they get across the bridge, weather permitting, and there will be enough pediatric vaccine for all P.E.I. children ages 5 to 11 years. Community-based clinics for children aged 5 to 11 will begin later this week. Parents will have a choice to have their child vaccinated at a community clinic or a school-based clinic. Only children with a consent signed by a parent or legal guardian will be vaccinated. Marion will provide details regarding the clinics and how parents and guardians can begin booking their appointments, and I think that process will be able to start this afternoon. To assist in planning to immunize children aged 5 to 11 against COVID-19, parents and guardians were surveyed, and the majority of respondents plan to have their children immunized. And interestingly, we had 51% of respondents identified preferring to have children vaccinated at a community clinic, with 46% preferring a school-based clinic. So really almost an equal split. The feedback from parents and guardians was very helpful to our office, and I know to Health P.E.I. in planning the rollout of the pediatric COVID-19 vaccine. So thank you to many parents and guardians who took time to complete the survey. And of course, we've also worked in partnership with the Department of Education and Lifelong Learning and the PSB and Commission Scolaire Langue Française. The approval and availability of pediatric vaccination provides an option for significant added protection for school-aged children against COVID-19. Having children vaccinated will be an additional layer of protection for families and the island as a community. We know the fourth wave of COVID-19 is having a greater impact on children under 12 years than previous waves. So now is the time to be vaccinating children to give them extra protection against COVID-19. Children can develop serious complications related to COVID-19, including multi-system inflammatory syndrome and long COVID. I urge all parents and guardians to have their children immunized against COVID-19. I do know some families who are keen to have their children immunized and will be making vaccine appointments today, while others are undecided. And it's important that we support parents and guardians in whatever decision they make regarding having their children vaccinated. For parents who are undecided, please talk to your physician or nurse practitioner regarding your concerns. And you can also seek information from other trusted and credible sources, including the Canadian Pediatric Society, the IWK or Toronto Sick Kids websites, the Public Health Agency of Canada, or any provincial or territorial COVID-19 website. This is an exciting day for P.E.I. We will be receiving pediatric doses in the province and begin vaccinating island children under the age of 12 for COVID-19 by the end of the week. The pandemic has been difficult for children. School has been disrupted, extracurricular activities have been impacted, traditional graduations and special ceremonies were different, time with friends has been interrupted, and many youth feel lonely and socially isolated. COVID-19 has had a profound impact on the mental and physical well-being of children and their families. Having children vaccinated is a significant development in our fight against COVID-19 and will allow young people to safely resume their favorite activities and events, including spending time with friends and family. It is a challenging time for many P.E.I. families, workplaces, and communities impacted by the current cases of COVID-19. Thank you to the many individuals who are in isolation or following the daily testing protocol. Thank you for doing your part to keep yourself and others safe. Thank you to the staff of the testing clinics, the provincial lab, and public health nurses across the province. The last week has been demanding, to say the least. Thank you for your dedication, commitment, and hard work to keep our province safe. As we have said before, while we are weary of COVID-19 and ready to be done with it, COVID-19 is not done with us. And as we continue our COVID-19 journey, let us continue to be patient, and I have to remind myself that equally, and continue to be kind. So thank you, and I'll turn over to you, Marion.
Thank you, Dr. Morrison, and good morning, everyone. Health P.E.I.'s COVID-19 response work is focused on providing the case follow-up, contact tracing, and testing requirements to contain COVID-19 and prevent outbreaks, and in delivering vaccinations as well to the people who need them. With the announcement that Pfizer BioNTech vaccine is now approved for children aged 5 to 11, we're opening specific clinics for those children to get the vaccine. We know many parents are excited and anxious for their children to be immunized as quickly as possible and protected from the most severe effects of COVID. We are beginning the rollout, the vaccine rollout in Health P.E.I. clinics rather than in schools, after asking parents and on the advice of teachers and administrators on our schools and P.E.I. I would like to also thank all the parents and guardians who took the time to respond to our school-based survey on this issue. Many of you have told us that you'd like your child to have access to the COVID-19 vaccine for children in the quickest and most efficient option possible, and that you may be more comfortable with this age group being vaccinated in our Health P.E.I. clinics run by our public health nurses. These community-based clinics are also able to see more children per day and will be scheduled up to 150 children at a clinic. This speeds up the delivery of vaccines to our kids. In that survey, many parents also identified they would be comfortable with vaccines being delivered in school-based clinics as well, and so we will be offering school-based clinics in early January when the children are back in schools following the break over Christmas. It's important to know, though, these school-based clinics will be offered only for those students in grades 4 to 6. Parents will be able to book appointments for their child through a link on the Government of P.E.I. website set up with some specific information around the pediatric or child COVID vaccine, or by using our online booking system, which is Skip the Waiting Room, or by calling the booking line at 1-844-975-3303. And that booking can start this afternoon. There are no walk-in appointments for this age group at the moment, and pharmacies are not offering vaccines at this time for 5 to 11-year-olds. When booking your appointment online, be sure to book into a clinic noted for this child age group of those aged 5 to 11. Another important point I just want to comment is that children will need to have 14 days before or after any other immunization in order to receive the COVID vaccine. So consider this when booking your appointment if your child has recently received the influenza vaccine or one of our other childhood vaccine programs. Clinics will be offered in 5 communities across PEI, and they include O'Leary, Summerside, Charlottetown, Montague, and Surrey. Our first pediatric COVID vaccine clinic will be this coming Friday, November 26th in Summerside, and there will be 3 clinics running this coming Saturday, November 27th, and they'll be located in Summerside, Surrey, and Charlottetown. All of those clinic dates and the upcoming dates will be available online. We'll be taking advantage of the non-instructional school days and with the longer Christmas break for students this year to offer our community clinics, providing access to those who wish to be vaccinated. As I mentioned, the schedule will be available for the next couple of months later today online. As Dr. Morrison noted, this is a 2-dose series of immunization and provided at least 8 weeks apart for this age group. We will be booking the 2nd dose appointments with that time frame in mind when people come to our clinics to receive their 1st dose. I've heard from many in my own circles and from people who are excited about their children receiving the vaccine, and also from parents who are nervous about it. As a parent myself with 2 children in this age group, I understand the concern people have for their kids. Health P.E.I. will not be vaccinating any children in this age group without parental consent. These vaccines are safe, have been delivered to millions of children already in the U.S., and I'm looking forward to having my own children vaccinated. I also want to make a note to remind people about the booster doses of vaccine available for those over the age of 70, and for any of you who are over 70 to consider booking your booster vaccine shot if it's been more than 6 months since you received your second dose. Those can be booked at a local pharmacy or one of our COVID-19 vaccination clinics that's not for children, and for a walk-in appointment at those clinics as well. Receiving the booster is important for maintaining immunity. We've seen an increased number of people tested across the province recently, and especially in the cluster of cases in Prince County. Many hundreds of tests have been completed at both our Slemon Park and Charlottetown locations, and we also had high numbers at our Montague clinic. When we have expected increase in testing, we are prepared and bring more staff in and extend hours where necessary. And this week, the increase has meant some longer lineups for testing and longer waits. So we do appreciate your patience while waiting to be tested as necessary at these clinics. I haven't been here for a while at the briefings, so I do just want to take a moment to offer my thanks both to Dr. Morrison for the ongoing leadership of the Chief Public Health Office and her role in this pandemic. Also to our Health P.E.I. team, Island EMS, the Department of Health and Wellness staff who've been working together to ensure P.E.I. is protected and testing and vaccination is available for everyone. I especially want to thank those who've been testing Islanders since the beginning of this pandemic, the lab staff who process these tests so efficiently and quickly, and our vaccination teams and our public health contact tracing teams. They have worked tirelessly together. I also want to mention many people in the system who've really lived this COVID response from the beginning, and offer my thanks as well to everyone in the public who's received your vaccine and are following the public health protocols. You are all making a difference. Thank you.
And we'll open it up to questions in the media. So I'll start with those who are here in the room. So maybe I'll look over at you, Brittany.
Thank you so much for taking our questions today. I wanted to start by asking a little bit more about the situation, the cluster in West Prince, Western P.E.I. You mentioned that there are 7 new cases today, 6 of which are related to previous announced cases. So that one case is still under investigation. Is there any concern at this point about community spread?
I mean, we're learning more about the case. So the other 6 cases have been in isolation because they were all named as close contacts or identified as contacts previously. So they had a negative test at the end of last week, for instance, and have been in isolation. So those are perhaps easier initial calls to make because they haven't been exposing other workplaces or other people. So the other call, we just came in within the last number of hours, so it's really learning more about what that might involve and what the contact might be.
And now, I believe you said there are 22 cases within that cluster at this point. How concerned are you with how quickly those case numbers are increasing right now?
Well, as we mentioned, I mean, we've seen more cases really in the last week, and already so many this week. So we're concerned with the transmissibility that we're seeing, but at the same time, knowing that we have a high rate of vaccination in our population helps to. Is a positive thing too. So that will minimize the impact in terms of people getting really sick and hospitalized, and we don't want that to happen. I think it also speaks to the importance of boosters for those who are 70 years of age and older who are eligible. It also speaks to why we want to start vaccinating our children. So the more we can do to minimize the impact of COVID in this province, the sooner not only P.E.I. but the whole country will move through this.
Now you You did mention some reminders for people about, when you're not feeling well, not to go to work, if you have symptoms, to get tested. Will there be any sort of enforcement investigation involved in any of these cases in this cluster?
At this point, we are just wanting to make sure that we are isolating cases, identifying contacts, making sure that people are okay. It has not been, at this point, anything that we have identified from an enforcement point of view. These messages, I think, are good reminders. They're the same things we've been talking about throughout the pandemic as really important to minimizing the transmission of COVID-19.
Okay, thank you.
Thank you.
So this, I'll just introduce you. So
Yeah,
for those,
sure.
Cody
Sorry.
McCachran from The Guardian. Hey,
Thanks.
yeah.
So we're looking at vaccinating children 5 to 11. Before you had mentioned that when we look at our vaccination numbers, they sort of drop off with our younger group. I'm wondering, what is the plan to try and get these kids vaccinated when we can't really get those numbers of our youth group who are eligible vaccinated?
Well, I think it's a good question. We have now sort of 83% of those who are 12 to 19 years of age who are vaccinated, and that number continues to go up. So I think that's certainly a positive sign, and we're continuing to, that number continues to move. I think the accessibility for this age group will be important. So I think trying to respond to parents and guardians' indication of where they want their children to be vaccinated is part of it. There's a note going out to all physicians, nurse practitioners as well today with some of the vaccine information, and because I think they'll be good sources and can direct patients who have questions to good sources of information as well. So I think we're trying to get that information out. On the website, I know they've been working on a Q&A that is up online and will continue to be added to, because I think it's really important to be able to address the questions of what we know and what we don't know. And as Marion mentioned, it's normal for some parents to be hesitant, and we need to support the parents for whatever choice they're making, but also to be able to answer the questions as well as possible. And I also have 2 of my 4 children in that age group, so I'll see if I can remind someone in the family to start booking their appointments too.
Excellent. And with the current cluster in West Prince, as well as we're going into the holiday season, is there some concern that maybe some people are acting as if the pandemic is over or doesn't affect them? And if there is concern, what do you say to that?
Well, I mean, I also think about the holidays approaching, and we're looking at these numbers, not just here in P.E.I., but in our neighboring provinces. And I think some of it's natural. We've been doing this for a long, long time, and people are weary of public health measures. And I do think that we know that vaccine is a really important layer of protection, but it's not the only layer of protection. And so when I see what's happening, I think it's really important that we keep multiple layers of protection, and it's easy to become complacent with some of these measures, including myself. So when I see how easily this can spread, we just have to think about the multiple layers of protection that we try to keep in place. But again, the good news is that at this point in time, these new cases are not in hospital, and I'm hoping that as a population that we're well protected enough that we won't impact the healthcare delivery system in the same way, and make sure people aren't really sick.
Excellent. As a kind of last remark, do you expect more cases in the coming days from this cluster? Based on what we've seen, or even some of the tests that came in last night and this morning that are close contacts, I would not be surprised. Thank you.
You're welcome. Julien, Radio-Canada.
Bonjour. Un mot tout d'abord sur ce qui se passe à West Prince. Peut-on parler de transmission communautaire et attendez-vous des nouveaux cas dans les prochains jours?
Bonjour Julien. Alors on a 22 cas qui sont vraiment liés à les cas qui viennent de Prince County. Il y en a 2 endroits où des personnes travaillent, où c'est affecté, puis il y a des équipes. Et puis il y a aussi un étudiant à Three Oaks. À ce moment, ils sont tous liés. On peut les lier ensemble, mais ça m'inquiète un peu qu'on a si grand nombre dans la dernière semaine. Et puis, ça ne va pas me surprendre si on a des cas qui arrivent encore dans les prochains jours.
Vous parliez de l'école Three Oaks, vous avez donné des numéros d'autobus pour des tests, etc. Est-ce qu'il y a un risque pour les écoles francophones de la région, notamment l'école Belle Alliance, peut-être à ce message?
Oui, et puis vraiment, quand on a identifié en premier les autobus, on n'a pas réalisé qu'il y avait tellement d'étudiants qui ont peut-être prendre le même autobus, même des fois pas au même temps. Mais alors, à ce moment, parce qu'on sait un peu plus d'informations et puis on a les résultats des premiers tests, on pense que le risque est assez bas, qu'on peut envoyer ces enfants, s'ils sont vaccinés ou non, qui ont voyagé sur ces 3 autobus, à retourner à l'école s'ils peuvent faire les tests.
Parlons justement de la vaccination pour ces enfants. Concrètement, comment ça va fonctionner pour les 5-11 ans? Est-ce que ça va être obligatoire où les parents auront le choix de décider?
Ils vont avoir le choix de décider pour les parents des jeunes 5 à 11 ans. Ils doivent signer un consent pour avoir une vaccination à l'école. Ils vont offrir les cliniques en premier dans la communauté. Et Marion vient d'en parler. Ils vont avoir les cliniques partout à l'île. Et puis après ça, on va aussi offrir une chance si c'est un choix pour les parents, pour les enfants de 4e à 6e année à l'école aussi. Mais c'est un choix. Et puis, j'ai pas mentionné ça en anglais, mais peut-être je vais avoir une question là-dessus, que à ce moment, les enfants âgés 5 à 11 sont pas partis de la proof of vaccine, les règlements à propos des proof of vaccine. Alors, c'est important, je vais peut-être mentionner ça en anglais aussi.
Donc, vous allez les ajouter, les enfants aussi vont avoir leur preuve de vaccination?
Non, pas à ce moment. À ce moment, c'est pas partie de la proof of vaccination.
Pour terminer, un enfant qui ne sera pas vacciné pourra continuer d'aller à l'école, pourra continuer d'aller à ses sports extrascolaires, sorties scolaires?
Oui, ils font pas partie à ce moment du Vax Pass. Et puis, et quand vous pensez à ça, ça va prendre 2 mois au moins, ça va prendre les prochains mois avant que les enfants de cet âge ont même la chance d'être vaccinés. Alors, ils ne sont pas inclus à ce moment au Vax Pass.
Merci.
Okay, I just thought I didn't mention it in English, and we'll have questions about it, that certainly even NACI, National Advisory Committee on Immunization, does not recommend that children aged 5 to 11 be included in the proof of vaccination policies or proof of immunization policies. So just to make sure that that's clear for parents, that at this point in time, that our P.E.I. Vax Pass does not apply to those who are age 5 to 11. And I mean, and even on a logistical basis, it's going to be a number of months before children in that age group, there are about 13,000 children in that age group in P.E.I., have a chance to be fully vaccinated. So, okay, I think I'll go to maybe who might be on the phone.
Gabrielle Drummond, Radio Canada. Bonjour, Dr. Morrison. Alors, ma question, c'est par rapport à la cible que vous avez dans cette vaccination des enfants de 5 à 11 ans. Alors, quelle est la cible de la Provence? Combien d'enfants on veut vacciner? Quel est votre objectif par rapport à ce pourcentage d'enfants qui seront vaccinés?
OK, bonjour Gabrielle. Alors, vraiment, le plus grand nombre que possible dans cette, entre 5 et 11 ans, on aimerait être vacciné. On a les indications, même des sondages des parents, de les écoles, qu'au moins à peu près 70% des parents ont les plans de vacciner leurs enfants. Et puis, il y a un grand montant qui sont pas décidés encore. Et puis, ils vont en faire, mais ils veulent attendre un peu. Et puis, je pense que c'est peut-être même un peu meilleur que les autres, les informations du pays, des parents de cet âge. Mais j'espère que ça va être similaire que pour les groupes de 12 à 19. Donc, on va essayer de vacciner plus de 80% des enfants.
Justement, aux parents qui sont peut-être un peu hésitants, qui hésitent à faire vacciner leurs enfants. Alors, est-ce que vous allez faire, par exemple, comme le Québec, une campagne publicitaire s'adressant aux parents qui hésitent à faire vacciner? Est-ce que vous allez essayer de les convaincre, justement, à vacciner leurs enfants?
On va en faire des façons différentes aussi ici. Un peu, on va assurer qu'il y a bon accès. On va assurer qu'il y a de bonnes informations sur le site web. On distribue informations aux médecins pour aider avec les questions. On va travailler avec les écoles, avec les communications pour avoir les meilleures informations pour supporter les parents pour faire une décision. On sait que les pandémies sont pas bons pour les enfants. Ils ont beaucoup d'impact depuis plus d'1 an et demi. Il y a des provinces qui ont beaucoup de font pas des études dans les classes. On était assez chanceux ici au grand parti. Et c'est pas vraiment chanceux, on a travaillé bien fort pour en faire, mais ils ont beaucoup d'impact pour les enfants. Et puis, j'espère que c'est aussi un autre pas en avance pour prévenir les impacts ou l'impact COVID-19 à l'île du Prince-Édouard.
Steve Bruce. Okay.
Yes, good afternoon to you both. Dr. Morrison, I know a couple weeks ago, close contacts of the Westwood and Elliott River cases, they were told they could keep going to school as long as they did a rapid test at home each morning, and there was obviously no vaccination requirement there. Now you have brought in that requirement in the Tosh case. Can you explain why you have gone that route now?
For those on the buses and the close contacts who are vaccinated at school, Steve, is that what you're referring to?
Yeah, I mean, if you look at the Westwood and Elliott River cases, you brought in the rapid test option, so students didn't have to isolate. And obviously those students were not fully vaccinated. And now, aside from the bus contacts, this time around with Three Oaks, any students that want to do the rapid test and keep going to school have to be fully vaccinated. So I wonder if you can explain why you've brought that requirement in.
Well, I mean, I think similar to, I think you may have asked this good question last time as well. So when we're trying to keep children in school and in their activities as much as possible, and you balance that with the risk of exposure. We certainly don't want more transmission within a school setting. So we're balancing both of those. And we're doing basically a risk assessment. So when we find out enough information where we can proceed with a testing option, I think we, in these cases at the school or on the buses, we're able to do that. We know it's not an outbreak at the school too, so I think that would change things a little bit. We know that in certain, this is not an option that is available, for instance, at one of the workplaces or at the workplaces that have been identified as outbreaks, even in our current situation. Regardless of vaccination status, they are not given the same option because there's just so much transmission. And those who are unvaccinated need to stay home for the 14 days. So it has changed based on our risk assessment, the fact that it's not an outbreak at the school, and we know that those who are, for young children, they haven't had that option until Friday of this week of starting to be vaccinated, but we know that those who are 12 to 59 years of age are, if you're unvaccinated, they're 45 times more likely to be hospitalized than those who are fully vaccinated. So we're trying to weigh all the information we have about the risk associated with the case and what we know about vaccinated and unvaccinated, even in the different age groups.
So does that explain, I know we reported on the ringette players who had an exposure at a game last week, and to our understanding, those players have to isolate, and even if they're fully vaccinated, they're not able to do the rapid testing each morning option. So does that come down to the level of risk from that exposure versus the school exposure?
When there is a transmission, and I won't speak specifically about one team or another, but when there has been a transmission based on an exposure of a case, we had to adjust, and we will adjust our direction. And the testing protocol might have been an option if there hadn't been evidence of transmission. And if there's transmission, then it's important for even those who are vaccinated to isolate for the protocol that we've laid out. And again, it's those who are vaccinated in those situations, and it would be similar in the workplaces or in the sports teams where we think there's been a higher risk of transmission. They're being treated almost as if they're household or higher risk close contacts. For instance, if someone drives with someone in a car for 8 hours for their work, they'd be similar to a household contact in terms of the exposure. And if they're not wearing a mask in certain situations, does that change things? And so there's a number of those kind of factors that go into place. People wearing masks in school, they're not wearing masks necessarily if they're playing on a sports team. So there's a variety of those things that I realize that it's sometimes hard for everyone to understand these protocols, but they're in place to try to keep people as safe as possible and minimize transmission, and we will adjust them so that people are able to go to school and work as much as possible, but not if it's going to put others at risk. And for those, for instance, who have been isolating after their first negative test and then become positive on a second test, they are also relieved that they haven't been out and at work or at school.
Just to clarify, there may be circumstances outside of the school setting where close contacts can continue, going to work, avoid isolation with the rapid test, but it really all depends on the risk with the exposure?
Absolutely. The only place we've rolled it out in terms of this daily testing protocol is with schools, and that is really given some of the risk and the importance for the children and for their families and the economy to keep as many of these students in school.
Mike McDonald, Canadian Press.
Is there someone else there?
Mike McDonald, Canadian Press.
Okay. Hello? I heard someone from the Canadian Press. No. Okay. Well, that's fine. So thank you very much. I think I'll be able to take some extra questions if okay, yeah. Go ahead, Julien.
Je voudrais juste être sûr pour que les parents, surtout les parents francophones, comprennent comment va marcher cette vaccination. À partir de quand les parents peuvent prendre rendez-vous pour leurs enfants? Comment ça va se faire? Est-ce qu'il y a un numéro de téléphone? Est-ce que c'est sur Internet? Et donc les premières vaccinations d'enfants débutent vendredi.
Oui, c'est exactement. Alors, il peut commencer cet après-midi d'appeler ou aller sur Skip the Waiting Room pour faire un rendez-vous. Et puis, il y a une clinique qui commence vendredi à Summerside. Et puis, le samedi, il y a 3 cliniques, Summerside, Charlottetown et Surrey, un samedi. Et puis, il y a une grande liste et puis de cliniques qui vont durer pendant les dernières semaines. Et alors, mais c'est pas drop-in, il ne peut pas faire un drop-in, il faut faire comme un rendez-vous. Et puis, ils vont avoir les cliniques à Montague et aussi à O'Leary qui fonctionnent dans les prochaines semaines. Alors, je vais même dire à mon mari, j'espère qu'ils vont aller sur Skip the Waiting Room cet après-midi pour en faire pour 2 des 4 enfants.
Je peux me permettre encore une dernière question pour vous aujourd'hui. Oui, on a un cluster, vous l'avez dit, dans West Prince, mais est-ce que vous, quand même, envisagez avec la vaccination des enfants, la double vaccination pour les adultes, une levée des restrictions, le retrait du port du masque? Est-ce que ça, c'est dans votre idée ou vous voulez attendre le 80% pour les enfants pour enlever tout ça?
C'est pas vraiment seulement lié aux vaccinations des enfants, mais on regarde toutes les indications, vraiment le niveau des infections qui circulent ici à l'île du Prince-Édouard, mais partout au Canada, vraiment le niveau de vaccination pour tout le monde, mais aussi le nombre de personnes qui ont les boosters pour qui sont plus à risque d'aller à l'hôpital. Et puis, on regarde ça tout le temps et puis comment on peut vraiment changer de pandémie jusqu'à endémie. Et puis, un jour, on ne va pas en parler en même façon.
Merci.
Okay, merci. Since I took, yeah, I'll this. Yeah.
I was just wondering if you could clarify a little bit about the cluster in West Prince. How widespread is that cluster at this point? Is it just isolated in West Prince? How far does it go?
No, so they're all linked to initial cases in Prince County, but there are. We mentioned that there are 2 workplaces. They both, the 2 workplaces are not necessarily in Prince County. And then we talked about sports teams being impacted, but also a student at 3 Oaks. So the number of people who are impacted in those 22 are in different parts of P.E.I. It's just that they're all tied and linked together.
Okay. Can you specify at all how far that spreads?
From one end of the island to the other.
Okay. And now I know that you mentioned that the workplace cases, the Tosh cases, those aren't being considered an outbreak, but it's fair to...
The 2 workplaces are considered an outbreak because there's been transmission within the workplace.
Okay, perfect. I just wanted to clarify that.
Yes.
Thank you.
You're welcome.
So, in June of this year, we had seen province go in and vaccinate high school kids during exam period. I'm wondering, have we ever returned to finish those vaccinations? And if we didn't, when can we expect those to wrap up?
Well, I mean, Marion may be able to answer that. So when we, I'll start maybe. I mean, so in June, there was some of the vaccination clinics were offered in junior high schools to give some students another point of access for those vaccine clinics. And then they were offered a chance to go to the public clinic over the summer because that's really what they wanted. And they were sent reminders of their appointments that were booked in August, for instance, a couple of months later. And I think that's really what has happened in terms of finishing up. There wasn't any school to go back into. What there are plans to do, and Marion can speak to it as well, is that public health nursing is going to be going back into the schools as well for some of the older age groups and offering a chance for vaccine in that age group. So maybe you want to speak to that too.
Yeah, we have actually. So Dr. Morrison's quite correct. We went in the spring to the junior high age groups to offer immunization in the school. High school students were done in our community clinics at that time, but we have gone now and out to some of the high schools as well now this fall, and they have already started that to try and offer another avenue for those students to become vaccinated, which would be in that 12 to 19 age category. So we have already started that with public health nursing, going out to the high schools as well now to offer some COVID vaccines on top of the other programs. So. Yeah.
And so in terms of the 5 to 11s who are now allowed to book appointments at community clinics, with any kind of appointment booking, especially if it's online, there's always some issues that pop up, things crash. Is there any concern that the infrastructure we have to set those appointments up online, is there any concern that there might be issues of crashing, delays, the typical internet stuff that happens?
I'll let Marion speak to
if the power goes out with the wind, then that's a problem. But actually, the Skip the Waiting Room site and service has been very reliable for us, so we don't anticipate any issues. We've continued to add clinics and have clinics booked all along, and it's just, I mentioned that I want parents to be aware of which clinic they're booking into, because we're also using it now for our influenza clinics, as well as our adult or age 12 and up COVID vaccine clinics, and these clinics will be set up just for those children with the different formulation of vaccine for those aged 5 to 11. So just to be sure, but the site has worked really well. We do have the phone line there and available for anyone who doesn't have access to that site online or prefers another option to speak to one of our booking clerks. So we don't anticipate any issues. I mean, people will be patient if everyone calls at once and we have 10,000 people or 13,000 on the line. That'll be a challenge, but I think we know that people will be wanting to book multiple children maybe for their families at the same time, and so we'll be trying to accommodate all those things as best we can.
Thank you.
Thank you.
Thank you. I think that's it. Okay, thank you very much.